I'm going to talk a little bit about solution-focused therapy today. I think solution-focused therapy is very unusual and unique in its approach and protocols. And some of them I align with, and some of them I am questioning. And I think that they can be problematic, perhaps, and unusual, especially if I'm not comfortable with them. I think calling a client a customer is an unusual protocol. And I don't know if this is always enforced in solution focused therapy. I like that we're being taught to integrate approaches because I think that technique or that language is something that I will not use because I see it as if the client is the customer, then what is my role? My role would be assumed as store owner. And to me, that makes the gap of the power dynamic larger. And that's not my intention. I would like to bridge the gap and make it closer within the power dynamic, especially when working with marginalized and diversified clients and groups. I just don't want to call them a customer because then I feel like I'm putting myself above them. And maybe I am feeling influenced by, is there negative stigma associated with the word customer after seeing so many clips on social media of poorly behaving customers uh, doing illegal things? So I just don't, I'm not on board with that language. However, I will employ that solution focused therapy. It does call the problem a complaint. And I think that is a great strategy of shifting language because I think this acknowledges that the problem is a complaint. And so it reduces its severity, I think, and it doesn't deny that it's not reality, but that it's just not a preferred reality. And I think this minimizes the power of life problems. So I think this is a good language to instigate for solution focused therapy by shifting problems to preferences. I agree that the miracle question could be problematic with some clients because they may not think very broadly or creatively. It may just be as simple as that. Perhaps they're introverted and don't have that kind of creative thinking installed in their cognitive processes. Also, I thought that like this could be problematic with severely depressed people. Depressed people who are in states of major depressive disorder may not see a miracle as available to them. It could be a suggestion that would make them feel worse uh, because they're still deep in their depression, and this might be something to utilize when they have achieved some positive outcomes. I think that clients also may have compromised neurological factors in which they just can't really comprehend what a miracle would be like. And also, like, what are people's belief systems? Clients may not incorporate miracles into their belief system. They might not even exist or believe in them. So I really like that and prefer that there's a suggestion of replacing the word vision with the word miracle. And to me, this seems more attainable and it's a closer reach toward a realistic and preferred future to me. So I think that I would shift and use that language instead. I really like how solution focused therapy includes very important people in their lives to offer outside perspectives for more collectivistic natured clients. But I would employ this technique with hesitation as well. Um, I considered the diverse populations that we will serve, and many people coming to counseling, they're coming because they're lonely and they're feeling isolated. And I believe there will be clients who do not have very important people in their lives, rendering this technique potentially harmful. For example, I think some veterans might fit into this category. Some substance use disorder clients might fit into this situation. And I wouldn't want to emphasize their isolation or their loneliness by suggesting this technique. So I have realized that when utilizing solution focused therapeutic approaches, I will utilize them with care and discernment, uh, because I think that it needs to be employed in very specific ways with specific groups and marginalized individuals. When working with diverse clients or groups, I think therapists should be in alignment with how the client constructs their view of their problem or their complaint. And I will validate the client's presentation of their personal experience of marginalization or diversity, so I can work with the client's constructed perceptions. I think this is important for me to see things from their viewpoint so that I can help them in a way that aligns with their language, their perceptions, their behaviors, and it will not seem so foreign or out of reach to them if I can employ this technique in that way. I will consider cultural experience of the client over interjecting my theoretical perspective, taking a lot of care not to inadvertently stereotype the client by focusing on their cultural experiences. So I really do want to understand them from their point of view and their standpoint, and also not accidentally cause them to feel stereotyped by doing that. So I will need to employ careful language and careful, attentive listening skills when utilizing solution focused therapy. Listening to clients carefully, as I just said at the onset of therapy, will be vital in deciding which direction I will steer my solution focused approach. I like the idea of identifying problem-free time periods in a client's life, if there are any. I think some clients may feel like they have not had problem-free time periods, and that could be a hurtful technique to suggest. And so, again, I will just have to listen very carefully because it could be very positively applicable to some and not to others. I would like to listen to diverse client populations to define the goals that they want to achieve. I would like to understand what potential solution, what that might look like to them personally. Identifying and naming their strengths also would be a technique that I would employ. I think it's really important to acknowledge and recognize in the moment with genuineness a client's strengths and their resources that they can draw upon to resolve current complaints and to continue building a future that they prefer. I think this is a powerful technique that I will utilize with diverse client populations. And that is all I have to say about that. Thank you for listening.